What are the types of pain you can get in a hernia patient? Dragging type of pain, where? In the umbilicus. And what is the cause of this? Someone is saying strangulation, obstruction. Does this patient have strangulation or obstruction? No. Then why does he have pain? Good. So pull of mesentery is one of the common causes of pain in the groin because of hernia. Okay. So whenever a bowel enters into the hernia, the bowel is attached to mesentery, right? So whenever there is a drag on the mesentery, the patient will complain of what type of pain? So dragging type of pain in the groin. Okay, near the hernia site, in the groin, they will complain of pain, which worsens over the daytime. So whenever the patient is standing for a long time, then the pain will gradually worsen. In the evening time, when he is lying down, the pain relieves. Okay, that is one type of pain. Any other type of pain you can get in hernia? Okay, good. So think in terms of complications. So colic abdominal pain, as you rightly mentioned, where? That is the cause. So good. Obstruction causes colic abdominal pain. Where? Depends on the bowel which is into the hernia. If it's a small bowel, then usually it starts in the periumbilical region, and then over a period of time, when the obstruction worsens, becomes diffuse abdominal pain. Okay, if it's a large bowel, commonly if it's a sigmoid, then initially sigmoid is a derivative of hindgut, correct? So hindgut, wherever there is a pathology, the initial pain can present it in hypogastrium. So midgut umbilical, foregut epigastrium, hindgut is hypogastrium. Okay, but when the pain worsens, obstruction becomes more and more, what happens? It becomes generalized abdominal pain. So this is a colicky abdominal pain. So this can also happen in inguinal hernia when it is obstructed. So one is dragging type of pain, other one is colicky abdominal pain. Any other type of pain in hernia? Good. Strangulation, the intensity of pain is more. What is the site of pain in strangulation? Colicky abdominal pain சொல்றீங்கல்ல. So strangulation, where will be the pain? So strangulation, the pain is usually over the hernia. Okay, because there is localized inflammation in the site of hernia. So initially pain in the groin because of drag of mesentery, then colicky abdominal pain because of obstruction. Later on, when it becomes strangulated, there is local inflammation and infection at the site of hernia, and the patient will complain of severe constant pain over the hernia. So if the patient complains of such things, then you will think in terms of strangulated inguinal hernia. In strangulation, patient will usually have signs of obstruction also. Okay, what is strangulation and what is obstruction? Okay, good. So when the lumen of bowel get compromised, the patient goes into obstruction. When the neck of the sac is narrow, usually which happens in indirect inguinal hernia or femoral hernia, the patient can go into obstruction. But when the neck is very narrow, it throttles the tissue and the blood supply to the bowel. So obstruction along with compromised blood supply, it is strangulation. Okay, so that is the last stage, which is a surgical emergency, and that cannot wait. The patient has to be explored as early as possible. We have to relieve that obstruction and strangulation, or else initially the lumen is compromised, later on the vascularity is compromised, but if you intervene early, you can save the bowel. Over a period of time, if it's become few hours, then the bowel will go into gangrene. We will have to do a resection, anastomosis, or do a stoma, and at that point you won't be able to do a mesh repair also. because there is, you have opened the bowel. Mesh, you are using a prosthetic mesh, correct? Toluene mesh the commonly used. So for that you need a sterile environment. If you have opened the bowel, you cannot use. If there is features of infection, you cannot use. There is features of strangulation, you cannot use. Okay, that is why you have to operate on the patient early, because if the bowel has gone into gangrene, you can only do an anatomical repair, which has a very high risk of recurrence, and there is more chance of infection also. Surgical site infection is also a possibility.